Hello everyone, and welcome to the first in our second series of person-centred care and practice webinars. I'm Bronnie Smith, my pronouns are she, her, and I'm the Program Manager of the Partnering with Consumers team here at the Australian Commission on Safety and Quality in Healthcare. I'd like to acknowledge the traditional owners and custodians of the lands that I'm joining you from today, the Gadigal people. I pay my respects to their elders, past and present, and celebrate the diversity of First Nations peoples and their ongoing cultures and connections to lands and waters. I would also like to extend that respect to any Aboriginal and Torres Strait Islander people joining us today. It always was, always will be Aboriginal land. The focus of today's webinar is on how the expertise held by those with lived experience is being recognised and harnessed in mainstream health. Lived experience knowledge is often more than an experience of illness or accessing services, and can include understanding of marginalisation, stigma, and discrimination. It may also encompass experiences of healing, recovery, and wellness. Drawing on this expertise to shape service design and delivery has been a feature of the mental health sector for a long time and seen as a key part of providing person-centred care. Our webinar today will explore what this looks like and how it can be embedded in other health settings. Before I introduce the presentation and guest speakers, I'd like to remind viewers about our Person-Centred Care Network and Person-Centred Care Insights newsletter, which will be released shortly. Please take a moment to sign up and keep up to date with person-centred care projects, as well as new resources, research, and publications. Our Person-Centred Care Resource Hub is where you can find all things person-centred care, including information about our network, recordings of past webinars, case studies, and more. Our presentation today will be followed by a live Q&A session with panel members. Please type any questions for the panel into the Q&A function. At the end of the webinar, you'll also be sent a short survey and would love your feedback. I'm delighted to be joined by the team at Western Health in Victoria, who are going to share with us their Lived Experience Advisor Program, or LEAP, which has created structured roles for people with lived experience across their services and has had considerable success. I'd like to welcome Alex Potter, Acting Director, Diversity and Inclusion, Rebecca Barbara, Acting Operations Manager, Consumer Partnerships and Disability Liaison Service, and Lived Experience Advisors, Phoenix Dean, Shefton Parker, Kate McKinney, and Melissa Richings. I'll hand over to Rebecca now.
Thanks, Bronnie, for that introduction, and thank you to the Commission for giving Western Health the opportunity to present an initiative that we think sets a new standard on partnering with consumers. My name is Rebecca, and I'm the Acting Operations Manager for Consumer Partnerships and Disability Liaison Services. Presenting with me today is Alex Potter, Acting Director for Diversity and Inclusion, and our Lived Experience Advisors, Melissa Richings, Phoenix Dean, Kate McKinney, and Shefton Parker. Before we begin, I would like to invite Emma Simpson, who will be signing the Acknowledgement of Country.
I'm Emma. My pronouns are she, they. I'm here today to sign an Acknowledgement of Country. I'd like to acknowledge the traditional custodians of the land, skies, and waterways, and pay my respects to elders past and present. I'd like to acknowledge the Wadawurrung, the Woiwurrung Wurundjeri, and Boonwurrung people of the Kulin Nation. I'd like to acknowledge all Aboriginal and Torres Strait Islander people here today. And I acknowledge the land always was and always will be Aboriginal land.
I would also like to take this opportunity to recognise people with lived experiences of trauma, neurodiversity, family violence, mental ill health, substance abuse or addiction, and chronic illness, as well as their families, carers, and supporters. Our appreciation extends to the clinical and non-clinical workforces that support people with lived experience. We all know what the ideal patient journey should look like and understand that there are processes and procedures that support it. However, we recognise that there is still much work to be done. No matter how much experience we have, even at the peak of our careers or as experts in our fields, true transformation comes from acknowledging that continuous education is essential. But how can we achieve this? We achieve this by consistently listening to those with lived and embodied experiences. Their insights are invaluable, offering perspectives that cannot be gained through reading, titles, or clinical hours alone. The most impactful thing we can do is listen and learn from those with lived experience. Western Health embraces the pivotal role of lived experience in healthcare through our Lived Experience Advisor program, or LEAP. We know consumer engagement is not new, but it's not always done right. LEAP stands for the Lived Experience Advisor program. This approach, developed at Western Health, was modelled from our peers in mental health and drug health services. It aims to elevate consumer engagement by employing consumers as lived experience advisors, or LEAs. LEAs are individuals with first-hand experiences in the healthcare system. They are brought into various health projects to provide insights that reflect the consumer perspective. LEAs contribute to improving healthcare outcomes by ensuring that consumer perspectives are integrated into project planning, quality improvement, and service delivery. The program has gained momentum across Western Health, with LEAs now being sought for roles that span across multiple departments and initiatives. We hope this momentum will continue to grow and other health services take the leap.
So how did our Lived Experience Advisor program start? It really emerged from us recognising the power imbalance between clinicians and consumers, and that traditionally healthcare projects and governance has been very clinician-led. When we spoke to our consumer advisors around this, they felt that sometimes they were just sitting in meetings, not actually knowing what is going on, and we wanted to do better than that. So we took on advice from our consumer advisor network, and we started a new approach, one where our consumer advisors are actually engaged as members of our workforce. So the Lived Experience Advisor program was established to really bridge this gap, where the consumer perspective is brought into every stage of a project or our governance committees, and allows the consumer advisor to be an actual member of workforce where their expertise is their consumer experience. So it's really a professional approach to consumer advisors and lived experience advice being embedded in all levels of our systems, our services and projects. So what do we actually want to achieve from our lived experience advisor program? We've got a pretty ambitious goal. We want to centre the consumer voice in all of our culture, enabling our lived experience advisors to really collaborate with the health professionals that they're working with. We want to empower our LEAs. We want them to really bring their perspective into all of our projects. We want to make sure that we're lifting the voices of marginalised communities when we do this, and that our consumer advisors and our lived experience advisors come from a really broad cross-section of our community. When partnering with consumers and ensuring that we have a patient-centred approach to our care, the LEAP initiatives and objectives are really around quality improvement, around delivering high quality care that is compassionate to everybody's needs, and around setting a really high standard for how we meet our partnering with consumers' requirements. So to ensure the sustainability of LEAP, we've had to have a strategic alignment recognised through our strategic directions to embed lived experience in our models of care. We have really diverse involvement of different community groups that are relevant to the catchment of Western Health, and we have detailed data to ensure that we have that representation right. We make sure our lived experience advisors are supported in a community of practice where they can share the areas that they're working on, also share different perspectives from across their diverse experiences. We recognise their successes and we promote them across the organisation and more broadly. And we have really clear processes and tools and support structures to enable them to do their best. It's important that the organisation sees the impact that LEAP is providing. We make sure that this is demonstrated back to the organisation through things like newsletters, in governance and project outcomes. We support our lived experience advisors and the workforce who work with them through education around co-design and partnering. And then we have strong leadership and advocacy from executive level down around this project. There are many research opportunities for our lived experience advisors to be involved in, one of those being looking at research and consumer participation right from the outset, which really demonstrated that we can do better in this space. And to further embed our research, we're looking at qualitative studies to really demonstrate the benefit of the LEAP initiatives throughout the organisation.
LEAP ensures meaningful partnerships through several key approaches. First, LEAs join teams early in projects, giving them the opportunity to shape decisions rather than react to them. They're also supported by a community of practice and a network of over 180 consumer advisors, representing a broad spectrum of backgrounds, cultures, genders, and abilities. Additionally, LEAP provides our healthcare teams with support and guidance on how to engage effectively with consumers and integrate their feedback into everyday practices. This foundation ensures that Western Health's teams value, respect, and actively seek out consumer perspectives, embedding them into everything we do. While LEAs and consumer advisors are invaluable to our work, they serve very distinct roles. Consumer advisors work within a volunteer capacity and are typically providing input on specific projects or are a point of consultation. These interactions generally sit within the inform to involve areas of Western Health's continuum of engagement. LEAs, however, are embedded within teams as employees, contributing not only to a single project, but also influencing the team's approach, culture, and long-term decisions. Working on higher levels of the continuum of engagement means LEAs can bring deep, lived experience that directly relates to the project or areas they are advising on. They have continuous presence of working alongside staff, shaping initiatives from planning stages through to the implementation, and ensuring the consumer voice is consistently integrated. Our lived experience advisors have played a pivotal role in a wide range of quality improvement projects, ensuring consumer-focused outcomes are at the forefront. By embedding the consumer lens from the earliest stages of project planning through the development and delivery, LEAs shape initiatives that are relevant, inclusive, and responsive to the community's needs. Their contributions ensure that consumer voices influence critical aspects such as design, evaluation, and implementation, fostering services that prioritize accessibility, equity, and patient-centered care. This collaborative approach not only enhances the effectiveness of projects, but also builds stronger trust-based relationships between consumers and healthcare providers. Uplifting the consumer voice and identifying barriers to consumer engagement form the cornerstone of the roles and responsibilities of the LEA role. These roles ensure consumer perspectives are meaningfully integrated into healthcare delivery through expertise and evaluation, facilitating diverse consumer participation, and developing educational resources to enhance staff engagement practices. LEAs advocate for consumers in decision-making processes, champion co-design and co-production of policies and services, and foster a consumer-centric culture that prioritizes feedback and continuous improvement. By identifying and addressing systemic and cultural barriers to engagement, LEAs play a critical role in ensuring healthcare services reflect the needs and priorities of the community they serve. LEAP is evolving and becoming more widely recognised across Western Health. With that, many additional roles are planned in the near future. These include an LEA role for an Indigenous elder to ensure the voices of traditional owners and elders are central in decision-making and governance. This role would ensure an elder sits on best care committees and supports directorate projects impacting Aboriginal and or Torres Strait Islander people. The new Melton Hospital LEA role will assist the project team to ensure a functional hospital design that responds to the needs of the community. An LEA role in community paediatric services aims to improve the triage systems through allied health services for consumers. And finally, Dementia Management Unit is looking to employ an LEA to assist in the redevelopment of the model of care for people with dementia. We are also early in discussions with multiple improvement projects across Western Health. Now our LEAs would like to share a little bit about some of the projects they've been working on and the exciting things they've been up to.
Hi, I'm Melissa Richings and I'm a lived experience advisor at Western Health. in my role as a lived experience advisor, I've worked in quite a few different areas. I originally started, the role was with the Joan Kerner Maternity Hospital to work on some particular projects there. But as I'm learning in healthcare, things get defunded or things change with government funding. So the original plans of what I would work on changed, but it's been really cool how agile things have been. I have been able to work on a lived experience led project, which is basically something where I've seen a need and said, hey, can I do this? And that was for the maternity area, creating what I call access guides. Some people would call them social stories. They tend to be things created for autistic kids. But what I've been doing is creating them with the lens of adults with a disability or neurodivergence. And they're visual guides for coming to an appointment at Western Health or at Joan Kerner. So to reduce the stress load of a person when they're coming to the hospital, where they have the opportunity to actually see photos of the space before they get there. So when they get there, they can be going, oh, yes, I remember. Oh, that's the lift I'm looking for. And it just makes the experience less stressful for them. So that's been really rewarding. The other things that I've worked on have included in the Melton paediatric space, there's a review of the allied health intake process, and there's also a review of the autism assessment clinic, which has been really rewarding as a mum of autistic kids and an autistic person. I feel like I have added a lot of value there, a lot of insights. And it's also great to see sort of behind the curtain, the inner workings of things and processes. Some of the other items that I've been working on, or some of the other projects that I've worked on, have included working with my colleague Phoenix. We've been working on the launch of the Hidden Disability Sunflower program at Western Health, which was, it all came about from the Disability and Neurodivergence Steering Committee, where consumers and lived experience and disability liaison officers all raised the need for it. And this was heard by our sponsors, and Western Health signed up for it. And then we were given the opportunity as lived experience advisors as to run that project, which has been new, scary, rewarding, lots of feelings, but also feeling really valued, and that the managers we work with have confidence in us and also support us so that we can succeed and they can succeed. So it's a really positive experience. The differences between moving from a consumer advisor to being a lived experience advisor, it's interesting because before I got the role of lived experience advisor, I was very much sort of thinking, what is the difference? Is it basically I just get paid and that's what the difference is? But no, it's more than that. Some of it is, well, because you become an employee, you now have a work email. You actually can log into the systems. You have access to SharePoint and Teams. So it brings a different feel to your connection to Western Health. You are a different level of being part of the team. A really good example that I can think of that highlights the difference between being a consumer advisor and being a lived experience advisor is, as a consumer advisor, I would be on panels and meetings, and I would participate in them and be aware of the different people in the meetings. Now, when I'm in a meeting, there might be someone in the meeting and something's mentioned in passing, but I'm like, oh, I know something about that, or I can help them. I now have the capability, access to the systems wise, where I can email them and say, oh, hey, this came up in the meeting. This is something I know about. I'm available if you want to catch up and talk about it. or I might send them some documents. A particular example recently was someone in the allied health space, and it had come up in passing in the Disability and Neurodivergence Steering Committee about the types of documents needed for NDIS plan reviews when a disabled person comes in because of a health issue, but it interacts with their disability, and then they're going to be going back home and need some support, more reports for NDIS. And I emailed that allied health person saying, hey, I'm autistic, I've had NDIS plans for quite a few years. I'm fairly comfortable with that process and I've learnt a few things in my time. Would you like to connect up? And we did, and that was great. And my managers were fine with it. They're like, if you can see a need, go for it. And so, yeah, it's been really positive to be able to be, I see a need and I can offer help. I'm really enjoying being a worker. The distinction, I felt valued as a consumer advisor, and it was an important step for me to go through that. I don't think I would have ever jumped at being a lived experience advisor in a paid role if I hadn't have been a consumer advisor for quite a while beforehand. But being part of the Western Health team, when I contrast it with previous employment experiences, I find the management and staff, the culture is so supportive, and so moving towards, we want to do more, we want to achieve equity, we want to hear what you've got to say. You're not a troublemaker, you're not rocking the boat, you're not telling them things that is just going to make their life hard. There is a receptiveness, and then that inspires thinking more and more about solutions. And yep, sometimes things you suggest, they're not a great solution or they're not viable, but it's a supported space where you feel safe to be able to do that. And you never know, you might make a suggestion or flag something and maybe it doesn't all work out, but it gets someone else thinking of something else. And these evolutions of ideas, it's really rewarding to see that in practice.
Hi, my name's Shefton Parker. I'm a LEAP advisor at Western Health. I've been working with the Office for Research at Western Health to better involve consumers in research at Western Health. The National Safety and Quality Health Services Standards Report came out last year and identified there was a need for Western Health to improve how it involved consumers in research, and they reached out to the partnership team at Western Health to see if they could get some support, who connected them to me, and we've been working together in a bit of a partnership, consumer and Office for Research, to try and come up with some ways to improve consumer involvement in research. So what we undertook at the start was a little bit of a baseline capability audit. So we looked at what the current use of involvement, the use of consumers in research was like at Western Health. And we used that to sort of try and work out how we were going to approach this capability challenge. From that, we moved into doing some more consultation with particular research groups to better understand how they're involving consumers in their research. We also did a bit of a literature review to try and work out what best practice looked like of involving consumers in research, and we were able to compare that a little bit to how Western Health was currently using and involving consumers in research. From this, we realized that there were some instances where it looked like there was good involvement of consumers in research, and then other areas it didn't look like much involvement of consumers was going on at all. So we decided to develop a survey to get a better understanding of consumer involvement across Western Health researchers. So the survey intended to look at what research staff's knowledge, training and confidence were of involving consumers, what their perceived barriers and challenges were to involving consumers in research, their support needs to better involve consumers in research, and lastly, what sort of education and training needs Western Health researchers might require to better involve consumers in research. So the survey surveyed 100 Western Health researchers, and the results showed there was definitely a real interest amongst researchers to better involve consumers in their research, but it also identified there was low current capability, so limited knowledge, and only some little sort of pocket areas such as allied health, for instance, where they were doing consumer involvement already reasonably well. There was also some myths involving consumers in research, so some sort of paternalistic attitudes towards it. Some people believing that there was going to be more trouble than good, which the research, when we looked at best practice involvement of research showed that involvement of consumers in research actually brings a lot of value to the research. There was also some strong appetite for researchers to do consumer involvement sort of ASAP. They're very, very keen to have the knowledge and the education and be able to start to build it into their own research. So from these survey results, what we've now done is we've developed education and training packages for research staff. So we've got them as 3 bite-sized levels. So there's an introductory level, an intermediate level, and advanced level training. They're designed to be delivered in 2-hour workshops. So yeah, some of the feedback we got as well from that survey helped us to identify how big the training should be, and what it should contain, so we're able to sort of target it far better that way. And it's hoped that as people at Western Health progress through these levels of research, they'll eventually become champions to provide peer support to those less experienced researchers or new researchers that come through Western Health. So we're working on the introductory training at the moment. We've just about finalised that, and that's going to be delivered at the start of 2025. So that's a little bit of info on the project I've been working on. Thanks.
My name is Phoenix Dean, and I use they, them pronouns, and I am a lived experience advisor. Within my role, I work within 2 main groups, the Gender, Sex and Sexuality Steering Committee and the Adolescent Community Programs at Drug Health Services. Within my role, I complete a number of different tasks, including committee meetings, project assistance, the LGBTQIA+ symposium, form recreation, assistance with the HWEI submission, resource creation, benchmarking, virtual tour creation for Drug Health Services, education review and revamp for the withdrawal unit within Drug Health Services, the development of young people rights within Healthcare Charter with collaboration with the Western Health Youth Consumers Committee, the Y, which I also co-chair, and project plan review. As a lived experience advisor, I feel my ideas and advice are heard and actioned. I feel like I am a part of the team. I feel appreciated for my input. I feel like I'm making a change in my passion areas. I am paid for my work.
I'm Kate McInerney, a lived experience advisor at Western Health, collaborating with the Disability Liaison Service for in-service, advocate for effective communication with individuals with disabilities, shares personal experiences to foster meaningful connections, aims to create an inclusive environment for individuals with Down syndrome in health services across Victoria. Grateful to my mum, Kerry, for supporting my journey, passionate about my role.
In conclusion, LEAP is more than just a program. It's a transformative approach to healthcare that honours the expertise and insights of those with lived experience. By embedding LEAs into our teams, Western Health is ensuring that every voice counts in shaping our services. LEAP has made Western Health a more inclusive, responsive, and compassionate health service for all, and we encourage other health services to take the leap. Thank you.
Thanks so much to the team at Western Health for that presentation. I found it really motivating to hear about the Lived Experience Advisor program, not just in terms of its positive impact, but also understanding the broad range of projects that the LEAs have influenced, from maternity services through to consumer involvement in research, to the Gender, Sex and Sexuality Project and improving communication for people with intellectual disability. We've had a lot of engagement from viewers, and I can see it's given us all a lot to think about. I'm hoping to have time to put a question to each of our guest speakers today who are joining me now on the Q&A panel. I'm going to direct the questions to individuals, but I'm really interested in everyone's perspective, so please jump in if you have something to add. Welcome everyone. Let's get underway. Rebecca, I'll start with you if I may. I'm interested in the evolution of LEAP, from planning through to piloting, and now as part of routine practice at Western Health. How important was it to be able to track and demonstrate early wins and successes? And can you reflect perhaps on how you did that and what influence it had on where LEAP is today?
Thank you for that. That's a really great question. So the evolution of LEAP at Western Health has been a really exciting journey, which has evolved really beyond our expectations. We always knew it would be a success, but for the organisation to lap it up so quickly really was a pleasant surprise, and it's been really well received external to Western Health as well. Don't get me wrong, any culture change is an uphill battle, but we certainly have really great leadership that have been on our side that has absolutely lightened the load. The program's origins were somewhat serendipitous. Back in November 2022, I joined the Diversity, Equity and Inclusion team as the Consumer Partnership Manager. Professionally, I was really excited about the challenge, but personally, as a mum of 3 little ones, I couldn't commit to the full hours the role was advertised for. So my manager and I got a little bit creative on what to do with these additional hours and discussed employing a consumer to work alongside me. And that single decision really set LEAP into motion. Previously, we had done some stakeholder engagement for our best experience framework. And our consumers highlighted recurrent themes that impacted their ability to partner, which include power imbalances and lived experience not being visualised as a type of expertise. So we got to work on what the lived experience advisor role should really look like, stemming from these themes and with consultation of our consumers and drawing from the lived experience advisor roles in mental health, all of which guided the development of our PD or position description for this pilot position. The pilot LEA role launched in early 2023, where they worked alongside me in the consumer partnership space for a few weeks, but the role wasn't really making the impact that we were after. Fortunately, the Timely Emergency Care Collaborative project came across my desk. This is a statewide project which was aimed to improve patient flow in emergency departments. And given our lived experience advisors' lived experience, we knew that they would be a really good fit for this project. So I spoke with the tech project team, and they were very happy to welcome a lived experience advisor and have them join a part of the project team. And needless to say, the pilot LEA's early involvement demonstrated the impact a professional consumer voice could have on improving systems and patient care. They respectfully challenged them and provided insight, which allowed the clinicians to view the project through that consumer lens. So it was a real win. To track this success, we implemented measures like weekly timesheets to evaluate the impacts of the LEA role. And these insights showed the demand for the LEA, which justified expanding their hours so they could take on additional responsibilities. Also a really great win. By October, we decided to start reviewing the pilot, and with our lived experience advisor, we refined the position description to create a generic lived experience PD, which could be adapted to meet the needs of specific projects. And this laid the groundwork for a scalable and sustainable program. Today, LEAP is evolving into routine practice at Western Health, where high-level engagements are referred to the lived experience advisor program. And these roles are embedded across various projects, and additional positions are also being developed or are being advertised as we speak. So yeah, it's been quite a journey over the last 2 years. Another method of tracking this success is through documentation of that journey. So we've written a case study on the Lived Experience Advisor program, which is currently under peer review. And we're also commencing a qualitative study to capture the program's broader impact, with plans to publish findings early to mid next year. So to answer your question in a really broad, very long-winded way, the success of LEAP is rooted in our commitment to tracking and demonstrating those wins. We know that LEAP is more than just a program. It's a catalyst for cultural change and embedding consumer voices into decision-making and setting a standard for what partnering with consumers should really look like. It's been an incredible journey so far, and we're really excited to build on this in 2025 and beyond.
Thanks, Rebecca. There's some great insights there. Melissa, I'm going to come to you now. You spoke about how your role as an LEA has seen you work in many different areas and how networks were sometimes part of how that happened. Could you perhaps talk more about the role of relationships in your work and why they're so important?
Yeah, sure. So I think at a very basic level, I think relationships are just important across the board, just for human beings. That with connection brings things like co-regulation, and that's how we thrive. And how I think that plays into the role of lived experience advisor is in having the connections at work, that is feeding into me feeling safe and connected. And when I'm feeling safe and connected, I'm better able to speak freely, offer my authentic self when I'm offering input. And also it's because of the supported environment and the relationships, it's easier to give effective opinions, like balanced opinions, because I'm not stressed out, basically. But yeah, the other things are where I think it's helping is I'm getting to know more faces and more connections, and able to message people. Like if I'm working on something and I remember dealing with someone else on something else, I can message them and be like, do you know who I can get in contact with about this? And I think also that is helping the broader experience of lived experience workforce within Western Health, because more staff are coming across me and the rest of the team and experiencing how approachable we are, and how thoughtful our contributions are and how balanced they are. And so then I feel that that's opening up the doors for, as more roles come up, it's just going to snowball in the right direction. I think that there's more traction and there's more engagement in every direction. Does that answer your question?
Yes, it does. Thank you so much for that, Melissa. I'm going to come to you next, Phoenix. I was really interested to hear about the many different responsibilities you have across your roles on the Gender, Sex and Sexuality Project and adolescent community programs at Drug Health Services. What supports, skills development or training have been important to let you be able to fully share your expertise in these roles?
As you said, I have been part of many different projects and completed many different tasks over my employment. A very big support for all of this work has been the amazing Rebecca. She has guided me through many tasks that I may not understand completely, and just sort of supported me through tasks that I thought I wasn't able to complete to par, which she continuously tells me I am very capable and am doing great. I have access to a wealth of research and training through our online We Learn course, like online course service called We Learn, throughout the entirety of my employment, as well as the amazing team of LEAs who I have learnt something from each and every one of. I have developed so many skills since starting as a lived experience advisor. I can't even count them, but I think the biggest one is that I have learned that it's okay to not know what to do, or where to start. And sorry, I've learned that it's okay to not know what to do or where to start, because I have an amazing team who are available and happy to help me where they can.
Thanks for that, Phoenix. I think there's some really great reflections there for all of us. Shefton, the next question's for you. And you spoke about your hope that a group of leaders would emerge from your work who would in turn champion the involvement of consumers in research and continue to support and mentor new researchers. And I just wondered how you see this work growing and improving over time and why sustainability is really important to the LEA role.
Sure. Yeah, I guess the work that I've been doing with the Office for Research, so that partnering work has revealed a lot of intelligence across the organisation around how consumer involvement in research currently sits. So it's helped to identify where champions sort of sit already. There are some champions there and they weren't necessarily getting utilised well. And because there wasn't really an education and training framework or a pathway that researchers could connect into at Western Health, it really meant that there wasn't that support offered either that would accompany developing researchers to be good at involving consumers in research. So the champions were going out and sort of doing that on their own. You know, there's training out there that anyone can sort of access around involving consumers in research. What's different about our training at Western Health is we're designing it specific for our workforce. So it's based on our community, it's based on the Western Health workforce's needs, and it's based on our community's consumer input as well. So we've really tailored the training for Western Health. It's probably not so portable. Aspects of it may be portable. You know, whilst, you know, Beck and the team probably be happy to share that with others. I would encourage probably other health services to go through that process themselves as well and think about, you know, what is their current capability? What does good currently look like in their organisation and where could improvement be made so that you can also tailor your education and training to the needs of the research staff there. Then hopefully developing that pathway, you'll start to recognise, you know, who are the champions in your organisation that you can sort of support out there to continue on the education and training. You know, it's not just one workshop or one set of training. You know, it's that being able to have the support around it that includes, you know, people with good experience of involving consumers, so that other peers can sort of support each other. Yeah, I hope that answers the question.
It does. That's really helpful. Thanks, Shefton. Alex, I might come to you now if I can, and I've got a two-part question for you. Firstly, I'm curious if you've noticed any changes in organisational culture or staff attitudes and behaviours since incorporating the LEA roles into the team. And secondly, if you have any advice for other health services who might be looking to introduce roles for consumers with lived experience in a similar way.
Yeah, sure, Bronnie. Happy to answer those. So I guess in terms of staff attitudes, generally it's not uncommon for us to get a bit of apprehension or a slight speed bump, I would call it, at the beginning. It's a change of practice. And as Shefton touched on earlier in the presentation, that health can be quite paternalistic. And one of the things we really identified early was there is a power imbalance for our consumer advisors who are sitting on committees or projects. When working with clinicians, they don't always understand a lot of the technical language or things that are going on. So to get around that, introducing the role as a workforce member was really designed to even the playing field a little bit. And of course, that means a bit of a change for the clinicians in the power dynamic, and some of them can be a little bit uncomfortable about that. Not overtly uncomfortable, but I guess subconsciously uncomfortable, and it comes out in different ways. So we work with the clinicians to support them, and often the best thing that can happen is that they can meet the lived experience advisor team and realise how wonderful these people all are, and that they're going to give them really good suggestions and help and be a member of the team, and that can usually overcome a bit of that staff attitude issue. Yeah, but I think it's just to be expected that they're going to be slightly uncomfortable about a different way of working to start with. In terms of advice to other organisations, and I've seen quite a few questions popping up in the Q&A about how is this funded and how is it structured, we're very happy to provide more detail on that. My suggestion to organisations would be think about it really early. Retrofitting it is harder. We don't have a designated funding stream for this. We just look at each individual project or opportunity, and we talk to the project team or the division who want to implement something about how they can creatively use their existing funding to fund the lived experience roles. So if a grant comes through and it's for a dedicated project, yes, of course, right at the beginning, it's very easy to say, well, this percentage will be used for a lived experience advisor and this percentage will be used for whatever other roles or resources. Later down the track, it gets a bit trickier, but like Beck mentioned, within our own team, what we chose to do is convert some vacant FTE into a lived experience role that would have otherwise been an administrative, leadership role. So I think it's about making that decision and committing to having lived experience workforce as part of your team. And then you just have to redistribute your funding accordingly. There's been a few questions too about what's the difference between our consumer advisors and our lived experience roles. So I guess the key difference at Western Health, our consumer advisors are essentially volunteers. They volunteer their time, however we remunerate them for their time. But they are strictly speaking a volunteer who is remunerated. They're not a member of the workforce. They don't have a contract, even if that's a casual or a fixed term contract. Whereas our lived experience advisors all have a contract. So they're employed staff member. Usually it's a fixed term contract and we're fitting roles according to projects. And so some of the questions have been there around how do we determine lived experience, or I guess in each situation it's different. So we look at the project and we see what kind of background and lived experience in healthcare and other aspects of their life that the person would need to have, and that's how we advertise the roles. So the person is being employed based on their lived experience as their specialty, as opposed to a clinician who has a qualification or a specialty area. Hope that answers a few questions, but we're happy to provide a lot more information in the chat or after the event around the actual technical details of how we run the program.
Thanks for that, Alex. I think those insights around the importance of sort of allocating sufficient resources and also the differentiation between the consumer and the LEA roles is really helpful. I thought what we might do now is actually move to a couple of questions that I'm going to pose to our lived experience advisors as a group. Everyone and anyone is welcome to answer. So Melissa, Phoenix and Shefton, I'm interested in understanding if you've ever felt a tension between sharing your personal lived experience and amplifying the voices of others with different but related experiences. And if you have, how do you balance that? Who would like to start?
I could jump in if that's
Thanks,
cool.
Vanessa.
I can't remember the specific example, but there was some opportunity that came up and there was a moment of, oh, I want to do that. But it was also like, but no, time for you to step back a little bit. And that's essentially what that moment was. I think, I don't know if it's a feature of people who want to do this kind of work. It's that sort of thing is very much on my radar. That I don't want to, in my enthusiasm to help, I don't want to tread on or silence other voices. And I think of, there's this quote, to be someone who quotes, true inclusion means learning that opening the door isn't enough. And that's something that I sort of like to have inform my actions, to be very mindful of that.
Thanks, Melissa.
Yeah, I guess taking a similar lens to Mel, yeah, I don't ever pretend to represent anyone other than myself. I advocate for others to the best of my ability. And I also advocate more so that if those people aren't part of the conversation, that they should be part of the conversation. Um, so as part of my role, it's often advocating that other people are there, not just me. Um, yeah, that's, I guess, the angle I take.
Thanks, Shefton. Phoenix, did you have anything you wanted to add there?
Yep, I'm happy to talk now. I think it's very important, something that I've worked on a lot is being aware that I am only one person and I only have one person's lived experience. And that is a big reason on why I am very out there in my community and having conversations with other people and trying to grasp and understand other people's lived experience. So I'm not only drawing on my lived experience, I'm drawing on everyone's. But I'm also very open with the fact that, again, I am only one person and I'm going off stories, not off, like, again, lived experience, like not my own personal stories, the other people's stories. And so, yeah, I use my community and I use the people around me, and I'm very open to the fact that I may be wrong. And if I am, tell me. I'm also very paranoid that I am always wrong.
Thanks for sharing that, Phoenix. That's great. I might just go to Melissa. We've had some questions in the chat about whether we have any practical stories about what's been done to enhance patient experience. And I wonder whether you might be able to reflect on some of the work you've done in the autism context around this.
Yeah, definitely. It's a project in process, but some of the things that have been really tangible is sharing my experiences of my kids going through the assessment process, and definitely having big moments where the clinicians are like, we hadn't thought of that. So a couple of the examples I would give is one of the processes was that all of the assessments, they would try and book all of the assessments in one day, which definitely makes sense, get it all done in one day. But what I was able to offer the insight to them was that this can be exhausting and really stressful for the kids and the parents. And then they're going home completely, they've used a week's worth of energy in one day. And that there could be value in staggering assessments, and potentially that would work to better outcomes for the kids. Like, you get potentially more accurate assessments. If you're not the last assessment of the day, you've got a pretty tired kid. And the other thing that I gave insight on was the reports that you get when kids are diagnosed. Families tend to be, that's the only document they have. So that will be the document that gets sent to school and gets sent to the NDIS. And I've been able to put on their radar that, could the document format be tweaked so that there's sections that can be sent to different areas? Because often, without even realizing it, when you're a stressed parent, you're sending so much personal information to all these different bodies, and you don't realize it until a couple of years later. And that was really receptively received. And so it's a work in progress, the project. So I can't comment to the tangible this and that have changed, but the process is that they're very engaged and interested to hear about what I'm contributing. And I feel like whatever the end product is, it is going to be different and informed by my contributions.
That's a great insight and example of what's happening in practice. Thank you so much, Melissa. What I might do now, just as we sort of come toward the end of the webinar, is provide an opportunity for final thoughts from each of our panel members about the value of having people with lived experience involved in shaping healthcare. Rebecca, I might start with you if I may.
Thank you. Look, I'm sure I'm preaching to the converted, but involving people with lived experience in shaping healthcare brings invaluable insights. And it really changes the relevance, effectiveness, and equity of the care that we deliver. That first-hand knowledge bridges the gap between the clinical services and the realities that our patients experience. So by having them involved in projects as a part of project teams, a valued member at the same level as everybody else, our services then align with the needs that our consumers really need. And it's then our lived experience advisors ensure healthcare is not just designed for the patients, but it's generally centered around them, resulting in better outcomes, stronger connections between the health service and the community that they serve.
Thanks for that, Rebecca. Phoenix, do you have anything that you'd like to contribute there?
I do. I think that having lived experience advisors is a very crucial thing. As I said, I'm very connected with my community, and they have, like, I have, spoken about different projects that I've been part of, and they themselves have attended the hospital and seen the projects in play and have seen that, comparing it to their experience last year to their experience today, it's a lot better and it's a lot safer and more comfortable for them to be there. I think that answered the question.
Yeah, thank you so much for sharing that. Melissa, I might come to you.
Yeah. Value of lived experience, sorry. I just went blank then for a second. One note that I wrote down for this is we're so far beyond being able to have everything created by white, straight, Christian, abled males. And that's sort of where it's coming from. You don't know what you don't know if you don't ask anyone else, if you don't include other people. And there's so much I don't know. I can speak to my experiences and the experiences around me. And I feel like it just makes everything better for everyone. Like, one thing I often say is the supports for neurodivergent people don't do any harm to neurotypical people. And so often that's the case. And then you take it the next step and then they discover things where they're like, oh, this is so much better because of something, something, something. So yeah, that's my answer.
Thanks very much, Melissa. Shefton.
Yeah, I mean, yeah, Phoenix, Mel, great, aren't they? I mean, there you go. This gives you an example of, yeah, I guess some of the influence that people with lived experience can have. And, there was some comments in there around culture. What impact does this have on culture? I think you're sort of seeing it here. We're each in our own spaces, doing our own things, and each of the spaces, as you can imagine, has different levels of culture, some being more inclusive than others, but we're each doing our work in those areas to make them more inclusive, to make them think a little bit more outside the box. So when you get all that together occurring in those different spots, you can see how as an organization that mindset starts to shift and the culture starts to shift, and you just get generally a more supportive, inclusive environment. For not just staff, but also for consumers that are going to be using those services.
That's a great reflection on the power of having lived experience at the table. Alex, I might come to you for final thoughts.
Yeah, look, I just think for the administrators, managers, leaders listening, I would just be brave and have a think about a way of doing things differently. It won't necessarily be smooth sailing right from the beginning, but there are organisations, and we're not the only one but we're very proud of our program to speak to. So, for example, mental health and drug health services have been doing these kind of programs for years, and we've learnt a lot from them. So look around, learn from your peers, or reach out to other organisations. There absolutely is a way to do this, but you've just got to be a bit creative and a little bit brave to do it.
Thanks, Alex. I think that's a fabulous note for us to end our webinar on today. I'd like to thank the team at Western Health. We really appreciate your time and effort, both presenting and also being part of the Q&A panel today. For those of you watching, thank you for joining us. I hope you found today's session useful. Please keep an eye out for our Person-Centred Care Insights newsletter, which is going to be released shortly, as will the recording of this webinar. We look forward to seeing you again next time. Thank you so much.